Bueno, buenas tardes, bienvenidos a todos,
Good
disculpen.
afternoon and welcome to you all. Sorry, we are a little bit late, but we wanted all the people to get into the room. As you know, this is the webinar where we are going to be showing the results of this project on sugar-sweetened beverages. I would like to start Federico Burone, who is the director for Latin America of the International Center for Research of Canada, which is the institution that financed this project for all these years, performed in Argentina, Brazil, El Salvador, and Trinidad Tobago. Federico, can you turn your camera on? Federico Burone. For some reason, somebody administering the conference is not allowing me to show my image. Okay, on the camera. They didn't want to see you. No. Okay, but I always find the way of making myself visible. Okay, go ahead. Thank you, Andres. I just want to welcome you all, as you did, Andres. I welcome you today. I welcome the researchers, the government representatives, the representatives of international agencies specialized in subjects like the ones we will be discussing now. I refer to PAHO in particular, or Pan American Health Organization. I represent the Canadian institution, IDRC. Our colleagues have worked close to us during these years, the group of researchers, and they have been able to move forwards in the development of evidence and reflection or discussion on the impact and implications. During these times, it is an imperative to analyze health policies and to analyze the relationship or the importance of chronic diseases and the impact they cause in societies. Today, we are assuming this enormous responsibility. IDRC is accompanying everybody at this stage where the production of robust evidence and innovative evidence in context where we worked, we've been trying to promote together with all of you that are participating in this activity, the incorporation of evidence related to public policies that seek to provide an answer to the possible causes of this crisis or behind this crisis related to the meaning of diseases like the ones treated here. And we all agree on that they are perverse diseases, especially in Latin America and the Caribbean, towards the most vulnerable sectors of society. And this is the aspect that led IDRC to generate or create these working groups that are at this more advanced stage today and who are going to lead us to discuss the evidence and pay special attention to the implications for those countries that were subject of study in particular and for the population in general in Latin America and the Caribbean. IDRC has worked on these topics, on aspects relating health, nutritional aspects, aspects related to habits like smoking, and also especially regarding the implications in the consumption of salt or salt intake. Today, we are very proud of the new evidence compiled through research and investigation during some years. This set of evidence can be shared. And we share a responsibility now, which is the formulation of recommendations for public policy making. I hope you have an interesting exchange webinar, and I will come back here to continue or to open up this activity.
Perfecto, Federico. Bueno,
Perfect,
muchísimas gracias.
Federico. Thank you very much. Thank you all. Let me introduce myself. I'm Pichon Riviere Andres. I'm director of the IX Institute for Clinical Effectiveness and Safety. That is one of the institutions that carried forward this project. Today, we are going to discuss the different results of this project that took many years in Brazil, in Argentina, in El Salvador, and in Trinidad Tobago, which main objective was to measure the disease burden produced by sugar-sweetened beverages. And why is it important? Federico mentioned it already, I believe. We have known, and there is increasing evidence about the damage caused by these drinks to health. But knowing this is not enough, and the measures that require implementation to reduce damage are complex measures and costly for society, not easy to implement. They may imply tax increases, changes in consumption habits, or not allow the sales of certain beverages at schools. These are difficult to implement by society and by policymakers and politicians. This produces a damage to health, but this is not always enough. Not everything important may be told. Not everything that may be told is necessarily important. But here, where we talk about disease and death, we can tell about this to those societies. And societies that believe that this is important, they should keep a record and understand what this means regarding death, damage to health, diseases. In the region, there was lack of information about the damage that sugar-sweetened beverages posed on health. Same thing that happened with tobacco. This lack of information is a barrier for societies and governments to take action, especially when these actions find resistance and it is difficult to implement them and costly. So first, we want to quantify in the countries what the damage to health represents and economy, the social burden of sugar-sweetened beverages. This leads us to measure the benefits of implementation of these policies, policies that are costly and difficult to implement, but they provide benefits to society, so we need to quantify them. Today, we will see the first stage. We will try to quantify in these 4 countries the damage, and that's the aim of the presentation and discussion we are going to have later. I'm going to try to share screen, okay? I believe you can all see from there. Just a comment, practically all the presentations that will be presented here are going to be in Spanish. If you speak Spanish, no problem, but some presentations are going to be in English. If you need translation into English, you can choose from the world on your right below the English option for interpretation, translation into English, and those that speak Spanish, if you need translation from English to Spanish, you can set the channel into Spanish to get the translation. This is the program, the agenda. First, we will have 2 speakers, Fabio da Silva Gomez, who is the Regional Advisor on Nutrition from the Pan American Health Organization. He has been highly involved in the project that started with the dialogue of policies in Buenos Aires some years ago with reps from many countries, where we discussed the different most important aspects and the responses of this research study. So it is a pleasure to have Fabio again for a presentation. Andrea Alcaraz, the main researcher of the study that is going to provide a summary of the results in the 4 countries. and then Ana Paula Bortoleto from Brazilian Consumer Defense Institute, who will coordinate the roundtable, and you will be able to listen to the vision of representatives from El Salvador, Trinidad, Tobago, Brazil, and Argentina about the implications of the results of this study, especially for those that are designing health policies and want to generate changes in society regarding sweetened beverages. So I will cease to share screen. I will give the floor to Fabio. Fabio, we can see you now. Thank you. So the floor is yours. The mic is yours. You have the floor. Thank
Muchísimas
you.
gracias, Andrés.
Thank you
Muchísimas
very
gracias
much,
por
Andres,
la
and thank
invitación.
you for the invitation.
Estoy
It
muy,
is
muy
a
feliz
real
de poder
pleasure
estar en
to
esta
be
ocasión,
here. I'm very happy
completando
on
este
this
ciclo
occasion to complete
y,
this
bueno,
cycle with
felicitando
you. And I
a
want to
IES por
congratulate
cumplir
the IX
con esta
for
jornada, con esta
complying or
institución
for organizing this
tan
so very
sustancial
important session, which is
o sea, no
very
solo para la
important,
evidencia,
not
para las
only from the
políticas
point of view of
necesarias para
evidence,
avanzar
but also from the
en
point of view of
apoyarnos en
policy
nuestra región,
making in order
en
to improve the
Latinoamérica y
health
el
of the
Caribe.
populations of Latin
Yo
America
voy
and the
a
Caribbean.
intentar ser muy breve
I'm going
porque
to try to
todos
be
estamos
short and sweet because we
ansiosos
are all
por ver
here
los resultados,
anxious
los resultados
to
del estudio.
listen to the
Así que voy a dar
presentation of the results of the
un breve
study.
recorrido
So I'm
sobre
going
la
to
situación en la región,
give you an
cómo va
overview
la
of the
agenda
situation
de
in
los
the
países
region
en
and the
Latinoamérica y el
agenda
Caribe
of
y
countries
cómo
in
hemos
Latin
apoyado,
America, the
pero
Caribbean, and
principalmente
how
cómo
we have
estos
supported
resultados
mainly how these
que
results
presenta IEX
that
son
IX is
fundamentales y nos
showing
ayudan
today
a
are
avanzar en
key
nuestra
and
agenda.
they help
Y
us move
empezando, bueno,
forward
por
with our
el tema del
agenda,
consumo,
starting by
hemos
consumption of
querido destacar algunos
sugar-sweetened
puntos,
beverages. I
muchos
wanted
de
to
los
show
estimados que
some
salen
important points
de este
here
estudio
from this study
indican que vamos
that
bastante mal
indicate that we are
en
not
la
doing
región
very well in the region
en
of,
principio mirando acá vemos que toda
if
esta
you
región es
look
la
at the
peor
globe,
región en relación
our
al consumo de
region is
bebidas
the
azucaradas
worst
en todo
regarding
el mundo.
sugar-sweetened
Y
beverages
tenemos todos
intake
los
or
países
consumption.
incluidos en el estudio y el estudio confirma
The study
que
confirms
ya habían
that our
realizado
countries,
este
as
estudio
was indicated by this
anteriormente,
study
comparando muchos más países
previously, if we compare
uno de los
ourselves to
países
more
de nuestra
countries,
región, y aquí está
one
incluido
of the
solo
countries
Trinidad y
which is
Tobago, tiene el
included in
mayor
the
consumo
study, which is
promedio de bebidas
Trinidad
azucaradas,
Tobago, has the highest
alcanzando
consumption of
casi 600
sugar-sweetened
mililitros
beverages,
por día de
reaching
bebidas azucaradas.
600
Y
milliliters
estamos
per
hablando que
day
mismo los
of
países que
sugar-sweetened
hay unos
beverages. We are speaking about countries that look rather green. The reality is more towards yellow or orange if we add the sugar-sweetened beverages that are defined as um, free sugar content. We don't have that on the screen, but when we add all the other sugar sweetened beverages that are not in this graph, situation gets even worse in the region. And in particular, we have a high concentration of problem in the Caribbean and not only in Trinidad Tobago, which is in the first place, but some other islands of the Caribbean are in a critical situation regarding the consumption volumes. But what is important is the magnitude of present consumption. What does this consumption represent in the um, eating habits of our populations? From previous publications, we have seen publications from PAHO organization within the universe of sugar processed products, sugar-free products provided by processed products. 71% of these sugar-free products are from sugar-sweetened beverages. This amounts to more than 5 million tons of sugar for the year 2014, only for a set of 7 countries, in spite of the fact that they um, have a lot of participation of the whole region. We have a brutal volume of sugar tons that are being introduced into the eating habits of our populations. for sugar-free products and for energy, sugar-sweetened beverages are the ones that lead the contribution of sugar-free beverages within this universe of ultra-processed products. Not only that, because this is always mentioned, but what about where we stand and the other sources of sugars? How do they increment or increase? We know that the trend, in addition to knowing that we have a high level of consumption, there is another trend of increase of these drinks. This justifies and reinforces the need of implementing policies to reduce the supply and demand of these products. And one of the things that I wanted to point out regarding the trends is that the trend of ultra processed products compared to not processed is quite marked. And here, if we compare period 2009 to 2014 with these data, we have been able to identify that the set of products, ultra processed products and packaged products, there was an increase by 28 or 32 times lower than the increase of beverages that are ultra processed, including sugar sweetened. So we have an increase of energy in these sugary beverages led by ultra processed products and sugar sweetened beverages. This is led by sugar-sweetened beverages. Regarding the trend, we hope this consumption, if we don't face it with fiscal policies and other regulatory aspects, we are not going to be able to stop this increase. Once we see a relative reduction annually throughout the last years, and this indicates that the trend will not change unless we intervene with good policies. This is why, and in order to close the comments, this is why the relevance in the burden of the disease that IX is giving us today, the importance to connect to exposure and the power to sicken and kill people with sugary beverages. This provides an idea of the impact because we know that the population is highly exposed. They can get seriously sick from drinking these beverages and even die. But the burden of the disease allows us to put together these two measures, and it indicates the impact importance, not only on health, but in other areas of society. So the relevance of all this to estimate the magnitude of the impact on health, but in other dimensions as well of life in society. Once we impact productivity, we are going to impact costs on healthcare, costs on healthcare that are well estimated, and this is very important because we are already communicating with society. This is not a problem of health impacts, but we are speaking about impacts that affect society as a whole. And the main thing to do is to justify action. We know that we need to take action, but also in some countries, we already suffer from lack of action, from inertia that does not allow those countries to take action, sometimes with a draft project or a standardization proposal or a law. So the action processes are somewhat delayed, and this information allows us to avoid this lack of action because other elements, for example, that are going to be used to oppose to the policies that we need to push forward. Related to contributions, I believe that it's going to be very helpful for the region and for all the countries alike that want to get benefits from these measures. It will be important for them to use these estimates in order to estimate the impacts that we may find with the interventions on the different scenarios. But there is also another contribution to seek accountability of the states and authorities of the different countries so that they can take action. Because now we have a very clear idea about how much are we ceasing to prevent, how many resources are not being allocated to health. And there is a contribution here in order to allow accountability. Those that have the obligation of protecting public health and better allocating resources. And finally, in order to align and to indicate how this aligns to the agenda, because the work that we have provided through IX speaks about the burden of sugar-sweetened beverages in our countries, but it also talks about the essential policies. And we are quite aligned, and PAHO is going to support countries in order to support warning labels, taxation of sweetened beverages, regulation of marketing of unhealthy products, food-derived products, and this includes sugar-sweetened beverages that need to be regulated. And with that, I will finish and I will thank you for listening to me. And I hope that this meeting will allow us to help countries progress by lifting barriers in order to take action. And I hope we can really act. The data we can see today for this set of countries will result in better impact for our societies and a better health for our peoples. Thank you. Thank you, Fabio, for your presentation. Thank you for accompanying us during these 3 years in the project. And now it's my turn to speak. I'm Andrea Alcaraz. I'm going to share the screen. Let me share the screen. So I am the representative of a big group of people who are working in this project on burden of the disease attributable to sugar-sweetened beverages in 4 countries, Argentina, Brazil, El Salvador, and Trinidad Tobago. What's the main objective of our project? Well, the objective is to generate information about burden of the disease attributable to sugar-sweetened beverages, but guide decision making on the interventions upon reducing consumption and promote public health in all the region, not only in these 4 countries. The project implemented the model in Argentina, Brazil, Salvador, and Trinidad Tobago, but the methods and framework are scalable to other countries and regions, and also to other regions. The selection of countries may seem strange, but we wanted to generate a model that could be adapted to the different needs, like countries that are overpopulated, like Argentina and Brazil, or small countries like El Salvador and Trinidad Tobago, and to have these different realities, these different views and types of consumption and types of needs for information upon generating this model so that each country can adapt the model for his own estimates. Along the same lines of thought, we generated this group of institutions, of which IX has been in charge of the data of Argentina and the general coordination of the project and development of the model. Brazil, we have ACT and the University of Rio de Janeiro that were in charge of completing the data necessary for the project. El Salvador, the Ministry of Health. And in the case of TT, the University of West Indies in Trinidad Tobago was in charge of the project. In all, we are more than 30 researchers. Impossible to mention their names, but a big group of people that worked together throughout 10 years. And finally, we had IDRC in charge. This is a big project and only a part of it can be visible. It started with decision makers, this process. The first thing we tried to do was to understand the problem. What are the needs for information that these countries have? How would they like to see the information? What do they want the information for which type of policies? And in parallel, many things had been done, like review the effectiveness of interventions performed, many infographic materials so that these technical aspects correlate to an illustration that we can show decision makers, countries. There was a systematic review of the possible models to define the burden of the disease. And finally, we developed our own model adapted to our region. In parallel, we accompanied this with a campaign on the mass media to show this problem in an agenda. Uh, so we wanted to have a sensitization work beforehand. You have all the material available on the page of the project. Let's look at the results of disease burden. We have a model. Many of you are not technical. I don't want to get into technical issues of the model. This is available on the web page. I want you to understand that this is a type of model that we have, which is a comparative risk model. This means that we perform estimates for Brazil, for example. What's the situation like in Brazil with the consumption of sugary beverages? And I compare it with the situation of Brazil if there weren't sugar-sweetened beverages. These differences between these two scenarios is what allows us to estimate what of what is happening is attributable to consumption of these type of beverages. One of the things we know best is that consumption of sweetened beverages make us gain weight. It increases body mass index. It relates to overweight and obesity. It's been studied that having overweight and obesity increases the risk of diabetes, cerebrovascular diseases, and some other conditions like cancer, renal disease, musculoskeletal diseases, Alzheimer, etc. We continued studying the effects of sugar-sweetened beverages, and we saw that including in persons that have a normal BMI, consuming sweetened beverages increases the risk of diabetes. We incorporated this in the model. It has been shown that consuming these beverages, in addition to the body mass index, it increases the risk of cardio and cerebrovascular disease or stroke. All these diseases are associated to a higher mortality rate and infarction, cancer rates, stroke, to have a bad quality of life, and to generate costs in the system to deal with these diseases. In addition to something which is not minor, it increases overweight and obesity, and this has an impact on health and the health system. Therefore, what does our model do? You can see here that I need to know how much is consumed of sugary beverages in each country. This data is a summary because the model incorporates consumption per age group and sex. So we need to know a woman between ages 18 and 40 in Argentina, how much does she consume? But if we group this and pull the data in order to know the problem along the lines that the previous speaker told us, adults in Argentina per year consume 85 liters of sugar-sweetened beverages. The situation in Brazil is 61 liters, 60 in Salvador, and 99 in TT or Trinidad Tobago. Trinidadians are worse off here. And not only do we consume a lot of beverages with sugar, but the prevalence of weight gain, uh, the overweight and obesity is elevated around the world. Moreover, in these countries, 66% of Argentines have a weight excess or overweight, 55 in Brazil, 62 in El Salvador, and 62 in Trinidad Tobago. What do we want to do? How do we associate this elevated consumption with this weight gain? What we want to know is how many cases of overweight and obesity can be attributable to sugar-sweetened beverages in adults, and put this a number because the number is very material, concrete. 514,000 adults are obese because they consume sugar-sweetened beverages in Argentina, 2,200,000 in Brazil, 93,000 in El Salvador, 15,000 in Trinidad Tobago. Looking into the size of Trinidad Tobago, 15,000 adults that are obese or overweight is a lot. There is another problem here in children. Look at this model where we see estimates for children and adolescents between 0 and 17 years old. I will present the information in another way. Think about, on average, girls in Argentina uh, in 240 milliliter servings, which would be a glass. Every day they consume more than a glass, 1.35 servings, and boys a little bit more. In Brazil, same thing for girls and boys. Trinidad Tobago the same, and El Salvador a little bit more. You can see that in all the countries, boys consume more than girls, except for El Salvador. In El Salvador, it's the other way around. And here I'm starting to see certain problems of each country and how it is important to incorporate this gender aspect in this analysis in order to promote the policies to change behavior adequately. Look at the prevalence of weight gain in boys, girls, and adolescents. I'm speaking about more than 30% in Trinidad Tobago and 12% in Brazil and El Salvador. It's very high. Overweight is multifactorial, right? Here we try to concentrate on consumption of sugary drinks. 774,000 children suffer from overweight because of that. 721,000 in Brazil, 21,400 in El Salvador, and 11,700 in Trinidad Tobago. This 33% of obesity in boys, 10% of cases of overweight, and 27% of obesity in Argentina may be attributable to sugar-sweetened beverages. If we stop consuming that, the rates should fall. Brazil 12% overweight, 9 obesity, Salvador 7% and 9, and Trinidad Tobago 15 and 15 in both categories. So far I spoke about obesity, and now we see the different problem of El Salvador. But let's look at this graph. It has a lot of information. Nevertheless, in blue, you can see women. In orange, you can see men. You can see them divided by age group, 0 to 4 years old, over 64, adjusted by population. So what I want you to see is that they are comparable. You can see that in all countries, the group of 18 to 44 in both sexes is a group that has a problem of overweight and obesity attributable to sugar-sweetened beverages. There are a lot of differences among the different countries. Argentina, where we saw that obesity was high and overweight as well, you can see how these groups play an important role more than in other countries like El Salvador. The same thing we had seen in children, that the problem was stronger in girls than boys in El Salvador, is seen also in adults. Women of 18 to 44 have a marked impact, or same as men, while in other countries the impact is lower. Here I talked about the impact of sugar sweetened in weight gain, but what about the rest of the diseases? All these diseases are considered because they are associated to consumption of sugary beverages. You can see ischemic disease, diabetes, atrial fibrillation, intracerebral subarachnoid hemorrhage, CVA, rectum cancer, esophageal cancer, bladder cancer, kidney cancer, uterine cancer, gallbladder cancer, lumbar pain, osteoarthritis, asthma, Alzheimer. And the model wants me to put together all this information: incidence, prevalence, mortality rate, risk attributable to sugary beverages consumption, and costs of treatment. How much does it cost to treat diseases? And you will see the results of the model. One glass consumption increases the risk of having a disease. This is data published. When we apply the model, we can see, I'm going to use another country as example. In Brazil, for example, we see that 1,300,000 of cases of diabetes may be attributable to consumption of sugary beverages. And this amounts to 16% of all the cases of diabetes in Brazil. In TT, out of all the cases of diabetes, 28% is attributable to sugary beverages. This amounts to 44,000 cases. And there is an increased risk of death. This is accompanied by deaths attributable to consumption of Ssbs. This is for the year 2020. Treating diabetes is expensive. The cost implied for the healthcare system is in dollars for you to compare amongst the different countries. $903 million in Argentina, 574 in Brazil, 43 in El Salvador, and 5 million in TT, an enormous cost for the treatment of these diseases. Diabetes is the star of the model because it has the highest impact. Let's forget about diabetes and look at the rest of diseases. They are grouped here, grouped. You can see the amount of cardiac diseases attributable to Ssbs. Same for stroke, for muscular skeletal diseases and renal. Some people don't want to go to work. They need to go to the kinesiologist, and this has an impact in their quality of life because they are in constant pain. Asthma, renal disease, and others. We have these events, 800,000 events in Argentina for 2020, 1 million, 1.8 in Brazil, and 50,000 in Trinidad Tobago, with a similar figure in El Salvador. We said that this is accompanied by death. Let's look here in order for you to have an idea. To round it off, Argentina has 45 million inhabitants, Brazil 211 million, El Salvador 6.5, and Trinidad Tobago 1.4 million. Look at the amount of deaths for 2020 in these countries attributable to Ssbs. This is a very interesting number, not negligible. We saw that these diseases affect age groups which are young, 18 to 49 age range, and they cause disability. If we measure this in terms of life years lost through disability and premature death, we see 110,000 in Argentina, 355,000 in Brazil, 16,000 in El Salvador, and 9,000 in Trinidad Tobago. And how much does the healthcare system help spend in dealing with these diseases? Most of the expense is incurred into by diabetes, but this is a pathology with a high treatment cost. The rest of the diseases have a high cost of treatment. If we add all this together, the estimates for 2020 result in that Argentina spent $1.1 million, Brazil 759 million, El Salvador 69, and Trinidad Tobago 23 million. For the budgets of each country, this is not a minor figure. It varies between 1 and 3% of what they spend in health care per year, so it's not negligible. What can I tell you other than this? The specific data of each country will be found in the web pages. You can see the links in English and in Spanish. The material is in English, in Spanish, and in Portuguese to facilitate sharing and use of this material with decision makers. You will find this type of bibliography in the pages, and you will also find what we did at a previous stage, which is the situation regarding different strategies to reduce sugary sweetened beverages in the country and what the country could do to improve the situation. A lot of documents and technical specifications that are in a friendly format, and many publications that are in the process of review. And last, to conclude, I want to go back to what got this project started. When we had this decision maker dialogue where we invited people from other countries and other people from Latin America to choose the best model, one of the first activities was to ask them, it doesn't matter if you cannot draw, can you draw the first thing you can think of when we think about sugar sweetened beverages? And look at how for some players the use of beverages was related to happy birthday parties. We saw a lot of drawings where we could see the problems at the beach and how people were exposed when they went to the beach, like Brazil and Trinidad Tobago, that are constantly exposed to the sales of sugar sweetened beverages, the problems at school, the 2x1 promotion of sugar sweetened beverages sold at school. We saw the role of gender, the mom as a facilitator of sugar sweetened beverages consumption, putting the sugar sweetened beverage in the backpack of the child, in the backpack. When you went to a music show, you were exposed to advertising and what this generates at an unconscious level in the street, at pizza places, subways, burger places, convenience stores, where you get the combo 2x1, a beverage with a burger, a pizza burger, or this drawing where you get that for $25, you get the extra large Coke or the refill, and how this generates abnormal consumption habits and how it got into our lives. You can see my lunch, a Coke, my lunch at the family meeting. Coca-Cola is always there. This is a picture of that event. It was a very important one. What we want to do at this session is that each of the teams of the different countries should tell us about how to use all this information, considering these particularities and differences at each country to promote policies to reduce consumption of sugar-sweetened beverages. This is all. Thank you very much. And I will give the floor to Ana Paula. Let me clarify that the questions are going to be answered at the end. We will have a session of Q&A of 20 minutes. Ana Paula, you have the floor. Thank you very much, Andrea. Thank you very much, and congratulations to the IX for your work and this project, which is so important. And it's going to help us as an example for other countries and regions around the world, no doubt. Since we don't have much time, I will invite the first panelist, who is Paula Jones from Brazil. She's director of ACT Health Promotion Sociologist in Studies of International Development from the University of Denmark. She's member of the Global Alcohol Policy Alliance and part of the management committee of the Alliance of Brazil for a Healthy Food Intake. Please tell us about the impact of all this for your policies in Brazil, and what policies are going to help you push forward or progress with all this. Thank you. Good afternoon. Thank you very much. I'm very happy to be here now. With everything that happened since we started with these pandemics that produced a lot of changes to our process. I want to thank our investigator from Brazil, the communication team, Rosa Mato, Ana Carolina Veldeheimer, that participated as well. I want to share some images that are fundamental in Brazil. In Brazil, we are using all these images for our work in our taxation campaigns. Can you see that? Yes? Good, good. In Brazil, we have an incidence on public policies about healthy feeding. We are using the data from the investigation for our campaigns. You can see a list of the topics, the campaign of mass measures, the report on taxation on sugary beverages that we will publish with our organization next month, material for the fiscal or tax reform. We are discussing in Brazil a tax reform, and in this tax reform we speak about an improved tax for alcohol and tobacco, but we never spoke about sugar-sweetened beverages. So this is very important material that we are achieving through our debates. We want this product to be taxed on or levied, and we are incorporating all the material of evidence and incidents that we are collecting on a web page. I'm going to show you each of the material with the different images. This is our campaign that's about to come out these days. And this is another campaign information where we use the data of diabetes in Brazil, and the numbers create an impact on people. When people look at the figures, they understand things in a different way. They are shocked, and the combination of figures with individual cases results in a very powerful tool for effective communication, to have a political incidence and to convince the population, because this happens in all countries. Taxation is very much rejected by public opinion. It's not an easy subject. And comments are, we don't want more taxes, we hate this. So this is powerful data in order to uh, get people started, and all the communication material here. And here, based on the data, we have a fact sheet. After the epidemics, we want to use these models at the Congress of our nation and other congresses in order to mobilize population. And at last, this is the webpage where we are putting all the evidence about taxation of these sweetened beverages. And the language is very simple for society to understand, in a very friendly language, very interactive, because today we have a pandemics of information as well. So the simpler and shorter, the better for the public. So, and this is it. Thank you very much. Great, Ana Paula. Yes, these are surprising figures for the campaign of communication, and very good to listen to your data and incorporate it in our campaigns. I invite the speaker of El Salvador, doctor in medicine with a master's in public health, for the University of Nicaragua. He is going to, he's also Director of Technologies of Health of El Salvador, and at present, he is an independent consultant and technician in statistics from the Catholic University of El Salvador for a project of professionalization of teachers at the service of learning through the National Institute of Training of Teachers. And he coordinates the team of researchers for El Salvador. Thank you, Ana Paula. Thank you. Before we begin, thank you very much. Good afternoon. I would like to thank the invitation extended to me by the IX coordinators. They have supported us a lot during these 3 years and longer as well in generating local capabilities in order to participate in these type of research projects that generate important evidence for decision makers at the level of public policy. It is very important as well to improve the public health and health of the citizens, and to make more efficient the use of public resources. We started to work with this project when there hadn't been yet a change in government in 2019, but we made a lot of progress in order to have the epidemiology information, economic information regarding the disease burden and the impact on health and on the public spending or government spending. We had a lot of difficulties regarding access to information of epidemiology, and we had some deficiencies regarding the IT systems and information systems that we have in the country, and the problems in the region due to the high segmentation, fragmentation that our healthcare systems suffer from. This makes it difficult for us to have everything unified and to have certainties about the diagnosis. Probably the data that has been presented today, probably this shocking data provides a clear idea of how big the problem is. Not only the burden of the disease and mortality, but the impact on costs for our countries. So this has been a project that left us with a lot of learnings, especially researchers, investigators, people from the Ministry of Health. We learned a lot through all this information. As I say, not only epidemiological information, but also information about the status of public policies to try to reduce the problem of consumption of SSBs, which is very strong in our areas and countries. And I believe that the results that are presented here today are strong enough to make authorities pay attention to the magnitude of the problem in their countries. Of course, given the situation of pandemics caused by COVID-19 we are immersed in, the focus of attention has been to control COVID, but there are efforts to mitigate or to keep on providing healthcare services and to mitigate also diseases caused by SSBs like obesity, overweight, and diseases mentioned like diabetes, cardiovascular, stroke, that pose a burden on our populations. I've lost personal friends and relatives to diabetes. So in addition to the economic impact and human suffering that the population is subjected to, some diseases may be preventable by changing eating habits and drinking habits and reducing incentives to consumption of SSBs. There is a big space of action policies in our countries. I believe that in the first place, we should replicate these type of instruments or tools in the countries of the regions of Central America, especially to look into the magnitude of the problem in the sub-region that has very similar characteristics inter-country, and the action should be of togetherness, everybody acting together, not in isolation, not in silos, looking at the development model of the region, especially some sensitive products like as sugar, which is a product that provides a high income and foreign currency to our countries as producers. And this has been one of the reasons why some policies have not progressed in the control and reduction of SSBs in the region. But as of the changes in El Salvador and a new administration at an executive level and a health ministry that has put the health of the population in the first place, we are quite alert to listening to the health problem of the population, and especially most vulnerable people. And I believe that this is an opportunity we have in order to create an impact on the region, on the country and on the region, and in three aspects. First, taxation. We believe that the tax burden of these drinks is very low. Secondly, in the reduction of consumption, lowering consumption, and the labels, including warning labels about the sugar content in these type of products. This not only depends on the country, but regulation at the level of Latin America. It should be taken into account. Um, And thirdly, very important in the educational area, to promote adequate consumption of drinks and the sales of unhealthy drinks. Though at this moment, many people there is an opening of schools now. Many people are studying at home, but children are now exposed again to the consumption of SSBs. Uh, Thank you for allowing me to express my concern, and thank you for helping us in our region. Giovanni, it's going to be very important to be able to help your countries. And now I invite Michelle, who is a nutritionist from the Ministry of Health from Trinidad Tobago, to share her ideas and the impact of the study for the policies in her country. Michelle, please, you have the floor.
Yes. Hello. Everybody's hearing me? Okay, great. All right. So I will share my screen. Thank you for the invitation to come today. And I am so happy to see the project has come to conclusion. We were extremely happy to be part of this particular project because we do have a problem with chronic diseases in our country, and we are seeing it now more than ever. During this COVID-19 pandemic, we are seeing a lot of persons with about maybe morbid obesity, class 3 obesity. They are the ones that are passing away, they are dying on our hands right now. And Trinidad and Tobago, we are in a very precarious position right now, as we have just gone into our, I believe this is our 3rd lockdown or so. And well, our 2nd largest lockdown, I should say. And we are in a state of emergency currently. So it is very serious. We are set to have an extremely high amount of cases by this month. Right? So putting that into context, I will start and we can present the information in my screen now.
Michelle, this is the translator. Can you hear me? Because your communication is quite chopped. It's quite chopped.
Oh.
Maybe you can turn your camera off because we are getting problems. Your
All right.
connection is all chopped. If you have a USB cable to connect to the computer, it should work better. Do you have it?
Are you hearing me a bit better now? Yes? Okay, great. All right. Well, I will stop the video sharing for now. Okay, so sugar-sweetened beverages policies. We'll just give a brief overview and we won't spend too long. And the other colleagues that we have taken that are within this project would be our colleagues from the University of the West Indies, Dr. Althea Laflucard, as well as Dr. Kimberly Ann Gittins-Baines, also of the University of the West Indies, Head of Economics Unit. And also we had Mr. Andrew Danu. He is also at the University of the West Indies, and he represents as well, he's the president of the Diabetes Association, who's also here today. And we also have some participants joining on from various, our Ministry of Health, as well as our professional dietetics associations as well. Okay.
Michelle, there's a little friction. I don't know if you're using headset and microphone, but there's friction. I don't know, with your clothes, you're making friction and the sound is quite difficult to be understood.
Oh, okay.
Maybe you can cease using a microphone and speak into the computer so that there's no more friction.
Okay. Are you still hearing the friction?
It's better now. Thank you. It's better.
It's better? Okay.
Yes.
All right. Let me see if I can change my slides. Okay, right. So there is a need to reduce Ssb consumption in Trinidad and Tobago, as it is an extremely urgent issue due to our chronic disease population and our demographics. These results from this particular study should strongly support the implementation of many of our policies that are currently in work to reduce SFB consumption in Trinidad and Tobago. However, we know that no one single policy will reduce all of these SSB consumptions to healthy levels. We know that it's a holistic approach across many different organizations of civil society and public sector. So just very briefly, the chronic disease profile of Trinidad and Tobago, that this is basically a snapshot of what is going on right now. Fruit and vegetable consumption is very, very low in our population, 91% having less than 5 or less servings a day, having less than 5 servings a day. Overweight, we have 36.9% of our population is overweight, and obesity figures, we have a percentage of 25.7% of our population, they are classed as obese. And top causes of death in our country, in Trinidad and Tobago, heart disease being number 1, followed closely by diabetes and cancer at 14% each. And we also have a high rate of cerebrovascular diseases, which is strokes. Just a little bit of background about our country. For those who may have not known before, that we were a sugar producing country. We had a lot of sugarcane plantations, and from the 1700s to about the year 2000, or that decade of 2000, early 2000s, our sugar industry was thriving. We had that influenced a lot of our eating and drinking. We have a lot of sweet drinks for Christmas. For example, we have a sorrel drink that we make, but it is extremely sweet because the sorrel is actually very, very bitter itself. And we also have something like Morbi, right? Those are bitter drinks that we over sweeten. And just in fact, most of our dishes are heavily based with sugar. We use sugar to color our foods and stews and different things. We have a wide variety of confectionery that is indigenous to our country as well. And we are also a country that produces a lot of rum as well, and consume too. So that is just a little background on that. And I'll just go through the current policies we have in tackling high consumption of SSBs. We released a policy in 2017, and it was called the Prohibition on the Sale or Serving of Sugar-Sweetened Beverages in Schools in Trinidad and Tobago. This would ban all soft drinks or sodas, as well as any added sugar sweetened juice in the school cafeterias in all schools within Trinidad and Tobago. So that was done in September 2017. Up until the end of 2019, the last report that we had for compliance on this policy by the schools was about 99% compliance for primary schools and 97% for secondary schools. The only thing with this particular tracking that we have is that it is still currently done by self-reports by our school principals. So we have a little bit of verification to do in terms of the implementation of this policy and further follow-up to ensure that the information that we are getting is actually verified. Another thing that we are actually working on right now is for mandatory nutrition facts panels to appear on all food packages. So locally in Trinidad, we are expected to submit this draft very soon, and it will be expected to put into legislation. At the same time, simultaneously, we are voting on a regional Caribbean region standard for nutrition labeling that encompasses everything from definitions, best by dates, sell by dates, everything, as well as nutrition facts and nutrients of concern, etc. So some current policies and strategies that we implemented already include the National Strategic Plan for the Prevention and Control of Non-Communicable Diseases in Trinidad and Tobago. This plan is actually taking into consideration a wide variety of sectors. and it will be due to be renewed in 2021 this year. Additional policies that we have in draft are the childhood obesity prevention policy, and there's also a national nutrition guidelines for schools for foods to be offered to children in schools. So these guidelines we are trying to put these guidelines in line with the power nutrient profile model as well. So that is to be expected to be done. Some implications for policies to reduce consumption of Ssbs. We are very focused on altering the obesogenic environment, in particular from the earliest stage of life, from infants to primary, then to secondary school. And we would like to emphasize ensuring other options are accessible and available, as well, fresh fruits and vegetables, etc., to replace those less healthier choices. And we would like to make consumer information a little bit easier in terms of Trinidad and Tobago is on board with the front of pack warning label that PAHO has endorsed. And we are seeing that there is a Caribbean-wide campaign through the Healthy Caribbean Coalition and PAHO. Their efforts are very much noticed, and I think there's a lot of discussion out there regarding to pushing this forward. So this looks like a positive thing. So in terms of further recommendations for reducing national consumption of sugar-sweetened beverages, the industry, we would like to continue to collaborate and partner with our food manufacturers, as well as have wide stakeholder consultations with our civil society groups. And lastly, we would like to use this information to perhaps push forward our sugar-sweetened beverage taxation policy that we've been in very much preliminary discussion stages. So it hasn't really gone very, very far. It's really in the preliminary phases. And I think with this particular information, this could be used to justify and provide economic information and so on, so that we can push these type of things forward. And that is basically the end of my presentation. I hope that was not too quick. And I'd like to thank you on behalf of my colleagues as well from University of West Indies and Diabetes Association. Thank you very much.
Thank you, Michelle. I believe that the study is going to be very helpful to help other countries in the Caribbean and other countries as well with our measures. Thank you very much, Michelle. And now I will ask Andrea, which are the next steps in Argentina? How do you see the implications of the different studies for decision makers in your country? Thank you, Ana Paula. Well, let me tell you a little bit about what I've been working on since Argentina was the country where we did the first test of the model. We had the preliminary results. With that, in November last year, we performed a very important event, very interesting. We presented all this in a webinar at a congress. What we wanted is to show all those who were working in the same direction, to show you that we were aligned and that we all need this type of information and we work in alignment all together. And we try to show the results and discuss all this. People from the Ministry of the Nation, PAHO Argentina, UNICEF, because this is a very important problem in children, people in Argentina that deal with these topics, representatives of Congress that want to promote laws on healthy eating or healthy habits, and the press, Nora Bar, for example. So everybody participated. And at a very special moment, because we are debating since October last year, the law of healthy eating. that contemplates some other things that have to do with consumption of SSB, like the labeling, the regulation of school environment, and advertising. So this was a timely moment in order to be able to show all this information. And after this webinar, we performed an activity and we summoned, um, and I thank the team of FISC for all their work. We put all together in a workshop 40 assistants discussing not only at a macro level, but people who are working specifically on the programs, people from pediatric societies, nutrition, cardiac diseases, and people who are working on programs, many people from the ministry, many people that have programs focused on children. So we debated specifically about 4 strategies that had been done, which are the ones that I told you about, and taxes. With taxes, we haven't done much so far. We progress, but then we go back like 2 steps, and we never come to what we expect. And this is an intervention which is very specific of SSBs, taxation. The other ones are more macro. But what we wanted to discuss with the other countries is that each of them could find the best strategy within their own country. We saw different ways of facing the arrival or the reach to these decision makers based on the role of our institutions. One of the things that came out at this workshop, and I want to underscore it, is that everybody was surprised by the economic data. They thought they were in another place, in another position, that they were spending a lot of money in dealing with diseases, and that this economic tool was an additional tool to use, the number of cases as well, and being able to focus on childhood, that this problem attacked children, not only obesity, but things that happen to children related to obesity, and to put this component into figures, um, to show that we are vulnerable societies, that children have a right to health, to work with the ministries of education. There is a very specific problem, and they felt that children data and figures would help them progress. I have nothing else to comment on. I want to thank all the people that helped us and help us every day and collaborate to disseminate the results. They are the ones that have assumed ownership of all these data. Last week, it was mentioned, the study was mentioned. We want to communicate all this, and the support of the rest of the institutions that make this data their own. They assume ownership and disseminate and help disseminate. Thank you, Andrea, once again. I believe it's an excellent analysis to implement this model amongst the other countries of the Southern Cone or Mercosur, because we are discussing labeling and other aspects of health, and also Uruguay and Paraguay. It will be very important for us in our regions at a political level. I congratulate you once again, and Ariel and Andres, I invite them to close. Thank you. Very good. Thank you, Ana Paula. Thank you, Andrea. Thank you, members of the panel. I wanted to tell you that there were a lot of questions in the Q&A and for the panelists. And let's start with the first question. Many attendees asked about the use of artificial sweeteners. Artificial sweeteners, are they beneficial? Are they as noxious as sugar? Alfredo Condri, Janet Tenorio, Claudia Vázquez, and Irina Mengual want to know about sweeteners, artificial sweeteners. Maybe Fabio can guide us here. Okay, okay, where am I? Yes, yes, from Tahoe organization, we are completing the preparation of a guideline. Since we have guidelines for sugar intake, sodium, saturated and trans fat, we have one that is about to be finished about artificial sweeteners, non-sugar. And of course, I cannot tell you much about it. I cannot tell you the conclusions of the guides, but what we have available is the systematic official review of PAHO organization that can help us a basis for these guidelines that are about to be published. And this systematic review gathers a set of evidence that uh, sweeteners do not generate a benefit to health. Sweeteners, non-sugar, are not beneficial. And I can put in the chat the web address so that you can access the systematic review. And soon we will be able to indicate or to disseminate the guideline on artificial sweeteners, non-sugar, and on the other hand, accompanying the results of this systematic review, uh, the PAHO organization says that many countries should take this measure, like in Mexico, and the draft project or the bill that has been approved in Argentina at the Senate talks about the inclusion of warning labels when there is the presence of artificial sweeteners, non-sugary, and this also caused by some effects um, about the increase of non-sugary uh, artificial sweeteners that have been found in Chile. Therefore, this is what so far I can tell you regarding the precautions we need to take regarding artificial sweeteners. Michelle, they are telling me to tell you to turn the camera on because everybody is going to turn the camera on. Okay. You saw that with Ariel, we've tried to answer some questions in the same section. Now we are going to allow the panelists to answer questions. I believe that one of these questions is for Andrea, made by Irina Mengual. What motivated you to perform this study in your countries? Thank you, Michelle. Paula wanted to say something about the sweeteners, the artificial sweeteners. Paula. Yes, Paula, you can do so. Thank you very much. In Brazil, when we speak about the tax reform, we are including artificial sweeteners and SSBs. We have a lot of roads here, even though the argument is that the evidence for sweeteners is not that strong as for sugar. There are other ways of dealing with this. Um, we have processed products, particularly Fabio talked in the case of Chile. We replace sugar in products for children, and we are talking about product categories which are not advisable for children. There are many ways of treating the artificial sweeteners in parallel with the evidence that is going to increase as time goes by. But there are important arguments to treat this topic. I will take the floor now to answer about the motivations. As everything in food, it's multifactorial. In my case in particular, I believe that what motivates me as a mother, because I'm a mother of two, and sometimes we think about their food and their feeding. Why do I give them an artificially sweetened juice, thinking that this is healthy when it isn't? And so I stop to think and I say, this is just extra calories. Why should I incorporate this into their eating habits? And from there, as a cardiologist, I have to tell my patients, don't drink sugary beverages. I always tell them not to smoke, but never not to consume Ssbs, because I was not aware of that problem. But now we become aware of that. Now I deal with public health and I start to see what methodologies do I have available to have figures to show people to make them change their habits. Perfect, Andrea. Paula, Ana Paula, Fabio, Michelle, would you like to add anything, Michelle?
Yes. So
Another question is about the sugar content and energizing drinks. And somebody else asked about powdered drinks, the ones that come in envelopes, if they were included in the study. Maybe I can answer, but the answer is general. Each country, depending on the sources of information that they had, they have a different mix of sugary beverages that represent them. What does the model include? Industrialized or sugar-containing beverages, not a juice where you include sugar in it. So the figures are even higher probably. And at each country we worked specifically. I remember the case of Brazil, where we had a lot of discussion. We called Ana Paula, who was not part of the team, to give us her input, to finish defining what should be included, what should not. Sugary milks are a problem in Brazil, so they are included. So we try to see in each country what best represented the source of information that we had. The powdered juices are not included in any country. Am I right? They are included or not? I think they are not. And every prepared juice and energizing drinks are included in all the countries, of course. Perfect, Andrea. Uh, Raise your hand if you want to ask a question or make a comment. I will ask another question. Maybe Fabio wanted to have the floor. Somebody asked, which country do we consider is a good example in Latin America, or which countries to this date implemented policies that you consider successful or an example to imitate? Fabio or whoever, but please raise your hand if you want to add. Yes, just a comment about energizing drinks that has nothing to do with what was included in the study, only to call the attention of other countries that want to regulate on Ssbs. This is a set of drinks that in some countries' legislation, they fall in the set of products that are considered uh, for special purposes. And this happened to us in some countries, and legislation sometimes applied to food and drink, excluding those that are of another legislation, and they exclude energizing drinks. In Latin America, this is a concern because in some countries in Europe and North America, we sell energizing drinks in cans of 220 ml. In Latin America, we sell them in bottles of 2 liters. Ha! So that's an important contribution in the set of Ssbs. For those that want to regulate all this, it's very important to have this group included in the regulations. Only the countries that have used measures that are an example for the region. I believe that Chile has been a pioneer in labeling the front label, warning label on the bottles, and many other countries imitated this. Regarding advertising, Chile has the best regulation regarding front labeling. Some other countries incorporated it. As evidence evolved, criteria, people more aligned with the PAHO organization recommendations after Chile, the case of Mexico. Mexico today has the best regulatory standard of labeling of the Americas and of the world, I would say. Once the warning labels have proven superiority vis-a-vis other systems from outside the region, like the systems applied voluntarily in Europe or in Australia and New Zealand. And regarding taxation, we've identified that we have 14 countries in the region that adopt taxes on Ssbs, but all these countries have space to improve taxation structure. Many of them apply taxes together, uh, uh, taxes on water, and this does not generate a consumption differentiation. So Mexico is our best experience so far, but we have a lot of space for improvement in these regards. And as far as school uh, food at school is concerned, or eating habits at school, Brazil is at the forefront. They have a structure in place which is agroecological, and it links to school. They provide healthy food at school. To give you an example of regulatory policies that are essential to regulate supply and demand of these type of beverages. Great. Thank you, Fabio. Daphne Herrero asks about the industry and if industry has strategies that place obstacle to healthy practices. Paula, would you like to talk about this? Well, the main problem that we have is that I believe that we lack evidence, strong evidence on the topics we work on, like front labeling, labeling the programs of feeding at school, marketing restrictions, etc. But the main obstacle we have for the incidence is the industry practices in Brazil. They are against the feeding guideline. They want to remove the ultra processed term and not associated to transmissible diseases. There is a strong pressure here in Brazil regarding taxation. We want to include also Ssbs in a special tax project. And we know about politicians in Brazil that they have received a lot of proposals from the industry saying that this is never going to work, that taxation on Ssbs will not reduce consumption. And this is the main difficulty we have in Brazil in order to progress with public policies and tactics. Mm. But it's always the associations that are behind the companies, and this happens in Brazil. For example, we see that Coca-Cola, through industrial associations, gives us the message that taxation won't work. And we have a lot of strong factors that try to deter us from taxation on Ssbs. That's the key problem we have in Brazil. To add to that, let me tell you that two important points are that this study adds, no, for industry practices are the evidences that there is a strong economic impact on taxation and other measures to regulate the eating habits. The costs of not doing anything about all these problems are very high as well. So we see obstacles to moving forward with policies, but if we don't do anything, the cost is going to be very high. In Brazil, we have problems with front labeling, for example, and the intention to stop the sales of Ssbs at schools. That was not possible to do. We couldn't approve a federal law to do this. So I agree with Paula, and material data of our project. These will be very useful in order to deal with these arguments and to keep on fighting for a better world. Giovanni wanted to add something, Fabio as well? Yes, Giovanni, thank you. We are about to finish the panel, and I only want to give you, to congratulate you and to congratulate PAHO organization for their leadership and ask them to keep on supporting us with some alternatives that maybe have not been seen in our countries because of the pandemics, because everybody is concentrated on COVID eradication. But this has a lot to do with the risk of death there has been and the amount of deaths because of the pandemics. It has to do as well with our immunological system and also the burden of chronic disease that we have in our countries. Both obesity, diabetes have been factors that have complicated people with COVID and led them to death. If they hadn't had diabetes or obesity, they might have survived the pandemics. And this is a factor that can help society become more sensitive and change their eating habits and drinking habits, and not think that people will do it just because, but find deeper measures in the sense of regulating adequately all these burden and all this commercialization in our countries. They are more accessible than water. I mean, Coke is better to find than water. We see them in bottles of 3 liters and a half. So people would rather buy Coke than water. So this is a problem. And we need to deal with this problem if we want to survive the next pandemics, because there will be a next one. So thank you once again for the invitation, and we hope we can contribute from civil society and the universities. We want to involve the academia in this type of works. I would like to make contact with some other universities that could be interested in facilitating a national dialogue in El Salvador, Trinidad, Tobago, whatever. Thank you very much. Thank you, Giovanni, Fabio, and the rest of the panelists. Do you want to add anything before we close? Yes, Fabio, aligned with Giovanni, I wanted to say that PAHO will always be there to help countries in the defense of public health. And I believe that we have mentioned the need of not allowing countries to go back on what has been conquered and achieved. We need to protect their achievements because we are at a moment where the most vulnerable population needs to have their health protected. In the case of populations that are not only exposed to increasing their risk of transmissible diseases, but non-transmissible associated to these products as well. And these systems of, we need to put an end to these producers that promote unhealthy eating habits. They use the argument that at this moment of pandemics, we shouldn't be regulating all these companies the other way around. I believe we should be stricter and regulate these unhealthy products even more because they are making vulnerable populations even more vulnerable, and they are making response to pandemics more difficult. So let's continue supporting each and every one of you in order to fight those that oppose to healthy eating and drinking. Thank you. Perfect, Andrea. Andrea? No, I only want to thank the people participating in the project as attendees to the event who are interested in this. Let's hope you can assume ownership and replicate all this, etc. Because the idea is, I would like to thank the panelists. There is a lot to comment on. Michelle, would you like to comment on anything or say anything before we leave?
Okay, yes. Hi. In terms of the results today, I think I'm very eager to get on the ground with some of our decision makers back at Ministry of Health. We are in a COVID crisis right now, yes, but we are seeing the levels of chronic diseases in the population just coming to the forefront because of the risks and the associations with our chronic disease population and COVID. So, and we also, due to vote regionally through CARICOM on nutrition labeling standards, that is actually currently going on right now. And there is a lot of push for front of package labeling. And I think sugar sweetened beverages, if we could even start with maybe just one, I think that will be a start. And if it starts with sugar, I think that will be something wonderful that could be implemented now. Since we have the data and we have all of the information we need to implement it, we can do that now. Yeah. So I would just really like to say thank you for allowing Trinidad and Tobago to participate in the project. As you can see, we have a lot of work to do in our population in terms of getting us to a healthier level in general. We are now notorious in the region for consuming a lot of sugar, right? And that's not a good thing. So we would like to improve that.
I think we saw what we all know, all the evidence in the world about the harmful effect of Ssbs on the health of individuals. Each new evidence shows that the damage is greater than thought of, as Andrea showed, not only through weight gain, obesity, but also diabetes, cardiovascular diseases that are independent of the risk of disease. So we are accumulating with this study and other studies a lot of evidence in the region. I want to be optimistic. When we look back on this, we will not conceive how we allow children and adults to consume indiscriminately a product we know is harmful, no doubt. I'm optimistic, and I think that this is what things are going to be like. We are wasting time. We know that this is going to happen, these restrictions on consumption. Uh, this is something that sooner or later is going to happen. These years that go by where countries do not implement these measures, this has consequences on deaths and diseases that are very important at the different countries. So the issue is not to discuss if we have or not a consensus around the world. We need a discussion about the emergency of the implementation of these measures in the countries. There's no reason to delay implementation. We hope we have contributed with our studies in order to move forward and faster in the different countries. That's all for me. I would like to thank the participants, colleagues from different countries of the region. And finally, remember that this webinar is going to be available next week for you who want to see it. On the IX page, you have the material, the results presented by Andrea and the panelists. If you get into the page, you can download everything from there. That's all for me. And I thank the participants and panelists and speakers and the attendees. Thank you. Bye-bye.